Good evening to everyone present here with us today. This is Shreyan from IGCP, today's moderator. I would like to welcome all the viewers who have joined our platform for better exchange of knowledge that is going to be shared by our keynote speaker, Doctor, for today's session. With much pleasure and honor, I would like to welcome a very renowned doctor, Dr. Sharda Jain. Ma'am is Senior Consultant of Ops and Gynecology Department, Director of Life Care and Life Care IVF, Expert Ethical Committee, and MC. Now, with the help of ma'am and her wonderful insight, we will be taking a close look on today's topic, which is social egg freezing, trends and outcome. Now, without any further delay, I would like to welcome ma'am at our forum and would like to hand over the session to her. Over to you, ma'am.
Thank you very much for giving me this particular platform. And on public request, I'm going to talk about on social egg freezing. Let me just share my presentation.
Yes, ma'am, your screen is visible.
Yes, social egg freezing made simple, and I'm doing this for public awareness. I think each and every thing which I'm going to tell you will be in a very simple language, and majority of things which you will not be knowing about it. And feel free to ask me question at the end of my presentation. Fertility is not a matter of chance; it is a matter of choice. This was said by Professor P.K. Devi, who was head of the department for many years at PGI Chandigarh. Most girls want to have a great education, want to have a great career, and want to make a name for themselves. In this process, they at times sit back and think about it that I missed out having a home, having a marriage, and children. And then she consoles herself, never mind, there is always a solution. I'm going to find a solution. So there is a revolutionary idea. Should you freeze your eggs if you are in your 30s? And this is definitely a revolutionary idea as far as 2025 is concerned and India is concerned. That is social egg freezing. Now, I'm going to solve this particular problem of yours through frequently asked questions about social egg freezing. Now, the first question is what do we mean by social egg freezing? Social egg freezing is the process of preserving a woman's egg for a non medical reason, such as delaying childbearing to pursue education, career goals, or due to absence of suitable partner. At what age is the egg freezing most effective? The egg freezing is most effective when done before the age of 35 or even earlier, as both the quantity and the quality of eggs decline with age. Studies show higher success rates when eggs are frozen in early 30s. Now, how is the egg freezing procedure performed? The procedure involves ovarian stimulation with hormone injections, followed by egg retrieval through a minor surgical procedure and a freezing the eggs using a vitrification, that is a rapid freezing method. The question is often asked how many eggs should be frozen for a good chance of pregnancy. The research suggests that the freezing 15 to 20 mature eggs offer a reasonable chance of one live birth, though this number may vary depending upon the age and the fertility health of that individual. Now, this slide is $1 million slide, which shows average number of oocytes for different ages. You can see on the left hand side, when the age is less than 30, you can retrieve anything between 15 to 20 eggs. But by the time she wakes up for egg freezing, she's 40. And if she decides to do that time, then the egg are very few and that also of not good quality. And it is a fact that all Indian women who are listening me, for Indian women, the ovarian aging is early. It for the Western counterpart is at 35. For us, it's 5 years earlier. Our All Indian Institute of Medical Sciences also their study has shown the same. Now, what are the risks associated with egg freezing? The risks include ovarian hyperstimulation syndrome, which is called OHSS. They can be bleeding, infection, and emotional eggs, but these are negligible, very, very negligible because the change of protocols and things like that, it has become very patient friendly now. Long term risks are minimal with current technology. How long can frozen eggs be stored? The eggs can be stored indefinitely, but most clinics recommend it up to 10 years. Some countries have a limits for storage duration as well. Now, what is the success rate of pregnancy using frozen eggs? The success rate depends upon the woman's age at freezing. For a woman who are under 35 and they've given eggs for freezing, the live birth rate per embryo transfer can be beyond 30 to 50%, which is very good, just like IVF at this particular stage. Is egg freezing covered by insurance? Generally, social egg freezing is not covered by insurance. Some companies in the West offer fertility preservation package as a part of the employee benefits, and you'll come to know when I'm going to talk about this particular aspect. How many eggs? How much does the egg freezing cost? The cost may vary, but typically range from $5,000 to $10,000 per cycle, plus the annual storage fees and future costs for IVF when using the eggs. In India, it is much, much cheaper. Are there any ethical concerns with the social egg freezing? Ethical concerns include societal pressure, commercialization of reproduction, and excess disparities. However, most view this as empowering reproductive autonomy of a woman. How does egg quality change with age? Egg quality declines with age, increasing the risk of chromosomal abnormalities and reduced fertility. Freezing at a younger age preserves the healthier eggs, which have a better outcome. Is there any age limit to use frozen eggs? Clinics typically allow egg use up to the mid 40s, as the risk of pregnancy complications increases with age. In India, the upper limit to have this kind of facility is 10 years. If you've frozen the eggs at 30 years, 35 years, up to 50 years, you can use it. Can frozen eggs be used for multiple pregnancy? Yes. If enough eggs are frozen, they can be used for multiple IVF cycles, potentially resulting in more than one child. What is the difference between the egg freezing and the embryo freezing? The egg freezing preserves unfertilized eggs, offering more autonomy, while embryo freezing involves fertilizing egg with the sperm before freezing. Now the requests have started coming that even married couples come and say that we are very busy, we want to freeze our embryos. How long does the egg freezing process takes? This process takes about 2 to 3 weeks, including ovarian stimulation, monitoring through the cycle, egg retrieval through a small procedure, and then freezing these eggs. Are children born from frozen eggs healthy? Current research shows no increased risk of birth defects or developmental issues in children born from frozen eggs compared to natural conception. Does egg freezing guarantee future pregnancy? No, it does not guarantee future pregnancy. Egg freezing increases the chance of future pregnancies, but does not guarantee it due to factors like egg survival and embryo implantation. What lifestyle factors can improve egg quality before freezing? Healthy lifestyle choices are that you should take a balanced diet couple of months before, regular exercises, avoiding smoking for 3 to 6 months prior to egg freezing, and limiting the alcohol intake during the treatment can improve your egg quality. Can women with the medical conditions freeze eggs for social reasons? Yes. Women with stable medical conditions can freeze eggs, but medical clearance by experts may be required to ensure safety during ovarian stimulation. That is must. How should a woman decide if egg freezing is right for them? Women should consider their reproductive goals, consider their own age, health status, and financial situation. Consulting a fertility specialist can provide a personalized guidance. Google and Facebook were the pioneers in incorporating egg freezing into their women's staff benefits. They were part of a larger societal shift towards recognizing and supporting the delayed family planning choices. Apple, Facebook, and Google by 2014 offered to freeze eggs for female staff, and Apple and Facebook went to offer $20,000 to their staff for freezing the eggs. Google also began offering a similar benefit to its employees, covering the cost of egg freezing procedure. This move was aimed at supporting women in the workplace by giving them more flexibility in family planning decisions. So, the impact on a working woman was large, promoting awareness among them by incorporating egg freezing into their benefits. These tech giants brought substantial attention to the procedure among working women. This helped to raise awareness about oocyte preservation as an option for women who wish to delay childbearing for personal or career related reasons. Now, it also influenced other companies. The decision of Google, Facebook sparked the interest and conversation among other companies across globe about expanding their benefits to include fertility related option, potentially influencing a broader cultural shift regarding reproductive choices in the workplace. Economic accessibility by covering the significant cost of egg freezing. These companies made the procedure economically feasible for their employees who might otherwise have found it financially challenging. They made a huge payment to them. Normalizing the discussion. The action of these companies contributed to normalizing conversation about fertility, about reproductive choices in the workplace. This shift encouraged discussion about family planning, fertility treatment, and a work life balance. Now, egg freezing is trending in India too for social reasons. Fertility extension for social reasons, increased and delaying chances of pregnancy prospects for another decade, that is up to 50 years. Now, here's a catch. By age 40, infertility is there in 90%. By 99% by age 42. Some people are in a habit of perpetual postponing marriage and pregnancy. And the study has been done in France, the perils of perpetual postponing. Just postponing the first conception attempt from 25 to 30 years reduces the mean number of children from 2 to 1.7. It increases infertility prevalence from 10 to 16% and increases incomplete families from 15 to 25%. Now, people have unreasonable expectations. 60% of childless working women aged 35 to 40 years in India are still planning to have a baby, but somehow not being able to find the time. 30% aged 40 to 45 years in Delhi University, one session I was a part of it, have started thinking about egg freezing. They haven't got it done. They are thinking about egg freezing. The reality not known to them about IVF live birth rate is the Western data to show that at age 40, it is 5 to 10% only. At age 45, it is 1% only. Now, this probes a question. In what other branch of medicine would we let patients insist that we perform an elective operation with less than 5% chance of its working? But women come and insist that they want to have their egg freezing even at the age 40, 42. Now, history of human egg cryopreservation is very interesting. The first pregnancy achieved was in 1980. Then many workers tried out. The procedure was almost abandoned for approximately 10 years due to poor results. low fertilization rate, low survival, hardening of zona, and a possible spindle damage. Then the vitrification came in Japan, and there is a special famous clinic, Cato Clinic. It showed that the survival rate of these frozen eggs was 94%, the fertilization rate was 90%, and the pregnancy rate brought about was close to 40%. Now, what is the difference between slow freezing and vitrification? Slow freezing is a history now. This gave crystal formation, spoiling the quality of eggs, which has been taken care by rapid freezing that is known as vitrification. What is the latest evidence of results of egg freezing from Japan? Now they find that the vitrification has a survival rate of these frozen eggs to 96%, and the pregnancy rate varies from 45 to 65%, depending upon at what age the eggs were frozen. The miscarriage rate remains same as 70 to 20%, which is just like a normal pregnancy. Now, other workers also started working and showed their results that the survival rate was close to 87-90%, and fertilization report was good, and the pregnancy rate was again varying from 30 to 50%. Now, question is asked, is it vitrification that's safe? The recent evidence shows that it causes less damage to spindle integrity and chromosomal alignment as compared to the slow freezing of eggs. A recent report of obstetric and perinatal outcome of 200 babies born from vitrified oocytes showed that there are no increased risk identified. So, conclude for people who are watching in India, as far as social egg freezing is concerned, we have a technology with us. Working women are trying to get pregnant when older, decade older. They want their own generic child, but still there are few enthusiasts in India, not very many. And that is why the request has come for talk of this kind on social egg freezing. If women in India wish to have egg freezing, they should have at a younger age, this egg should be frozen. As the pregnancy rate then in a late age are similar to fresh when using a young eggs. So अगर आपने 30 years में आपने 30-35 years में आपने egg freeze किए हैं, तो उनका behavior ऐसा ही होगा कि to have an IVF at the age 32-35. It's a good technique for a woman who wish to delay starting family due to various personal or professional reasons. Oocyte preservation offers an opportunity to preserve their fertility by freezing eggs at a younger age when they are typically healthier and more viable. By doing so, they are potentially increasing their chances of having biological children when they are ready to start a family. What we need to do from a public perspective. Public wants education and awareness, providing accurate information about fertility, reproductive options. The process of oocyte preservation is crucial at a young age and not at age 40 plus. Public education campaigns can help individuals understand the benefits, the limitation, and the potential risk associated with egg freezing. What do we need to do from a public perspective? Public wants to know accessibility and affordability. Making oocyte preservation accessible and affordable is important for broader societal impact. This may involve initiative to reduce cost, insurance coverage for the procedure. Ethical and legal frameworks, ensuring that the ethical and the legal aspects of oocyte preservation for social reasons are well defined and regulated. This includes consideration regarding consent, the maximum duration of storage, the potential implication of long-term storage. Now, supportive work environment is also needed for individuals considering oocyte preservation for career-related reasons. This might involve policies that accommodate the needs of employees undergoing fertility treatment, such as flexible schedules or benefits related to fertility preservation. It is important to note that while oocyte preservation can provide women with more reproductive choices and flexibility. It is not a guarantee for future pregnancy. Success rate depends on various factors, including the age of the woman at the time of egg freezing and the quality of the stored eggs, can impact the likelihood of successful pregnancy later on. So, to conclude, the ethics the parents and the governments have been trying to teach their daughters, lecturing their daughters to get married, to have children, still the women are trying to get pregnant when older. But the brute biology is in front of them. Women will live up to age 80 years, but most will be functionally infertile by age 40. They will be functionally infertile by age 40. So, in case if they have to do something with the social egg freezing, they must do it at less than 35, preferably 30 to 30. Will social oocyte freezing will make significant revolutionary impact in future? Nothing can be said at present as far as India is concerned. Thank you very much. If there are any questions, I'll be happy to take them.
Yes, ma'am, we do have some questions if you like
Yes,
to take that up.
yes, yes.
So, ma'am, the first question was, are there any risk of using older frozen eggs for assisted reproductive technologies?
Like when I told you just now that people know about that there is something like social egg freezing, but by the time they make up their mind and come to the IVF center for their eggs, they're at 40, 42, 45. Few eggs are frozen. They go through, undergo multiple cycles. They must have stored maybe 5 to 8 eggs. But the quality of those eggs are not good. The chromosomal abnormalities are plentiful. And that's why, in case if they're really serious about having a child of their own, they must get this egg frozen at an earlier age, always earlier than 35 years.
Ma'am, there is another question. What are the key points to include in the informed consent discussion regarding social egg freezing?
I made it very, very clear that it all depends on the woman's age. If age is younger, the quality of eggs will be better. So, say I take an example. If she has frozen the eggs at the age 32, quality is good. And because you freeze only A grade eggs, you don't freeze B grade eggs. Now it is expected that they will survive, they will fertilize, and they will have a pregnancy rate. But in IVF is one specialty where nobody can promise, nobody can give guarantee. It's a very likelihood that you will have your pregnancy, but no center is going to give guarantee that the eggs which have been frozen, maybe younger age it has been frozen, it will give you a pregnancy. No, there's no guarantee. So this is all goes into the informed consent.
And there's one last question. What are the
Yes.
implications of promoting egg freezing as a mean of delay motherhood?
See, the question is, let me be very frank with you. Today, every girl wants to be educated. Every woman wants to have a career, not only have a career, to rise in career as their counterparts. So you find invariably they're at peak at 38, 40, 42. When they're at peak, they want to enjoy that particular peak. So instead of having a child at 30, 32, 35, they will like to have a child when they are 45 or maximum 50. What the government of India allows, that they can have with these frozen eggs fertility pregnancy up to age 50 years. Some people say 48, some countries say 45 years. So they can delay their pregnancy by a decade, that is 10 years, for career reasons.
Understood, ma'am. Thank you so much for answering all our questions. That's all from our audience. Before
Thank you so
concluding,
much.
ma'am, any take home message?
The take home message is companies like Apple, Google, they offered their people who are working with them as a woman benefit package of $20,000. So they can think about it, and their mental thing is there, that I've frozen my eggs. The similar that it is trending quite a lot, but it is very expensive. So I find, many Indians who are working outside, they come to India, get the eggs frozen. But as far as the Indian population is concerned, I think the message should go wide through this talk of mine, which made things very, very simple. So they also understand what is social egg freezing guide. And if they have to get it done, they should get it done earlier than 35 years. So this is my last message. It has a promise, it is a revolutionary ideas, but they must make use of it.
Thank you
Thank you
so
very much.
much.
Thank you very
Thank you
much.
for joining us today. With your
Thank you.
permission, I would like to conclude today's session.
Thank you
Thank
so
you.
much. Thank you so much.